Hello, everybody. This is Gary. Today is Tuesday, November 1st, 2022. It's 10:54 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today, my symptoms are very bad. I'm very paranoid, very delusional, thinking people are following me, laughing at me, ignoring me, plotting against me. I'm hearing voices that tell me people are following me and plotting against me. My anxiety levels are very high. My depression is very severe. Um, my auditory hallucinations are pretty intense. Um, I'm just coping the best that I can. I'm about to take my noon meds. It's almost 11 a.m. So I'll be taking my noon meds in about an hour, and I'll also take some Klonopin to help me calm down. I'm allowed to take Klonopin 3 times daily, half a milligram 3 times daily for anxiety. I still have my other medications for the auditory hallucinations, the paranoia, and the delusions. I have Zyprexa and Seroquel to help me with that. Um, just trying to stick to my daily schedule. I just came back from outside. I went for a walk and did my physical therapy exercises. Um, I have a lot of intense physical pain in my legs. Part of it's probably due to the fact that I'm overweight. I weigh 230 pounds. I went to the doctor last week, and that's what I weighed in at, um, which is higher than even before. And my primary care doctor didn't say I was just overweight. She said I was obese. So I have to lose weight. Having to carry around that extra weight puts strain on my legs, and especially on my right knee, which I had surgery on May 13th, and the pain is still pretty intense in my right knee. Physical pain and fatigue tends to aggravate my psychiatric symptoms, including the auditory hallucinations, the delusions, the paranoia, the anxiety, the depression. Um, I'm not looking forward to winter. Winter's always a difficult time. It's going to aggravate my physical pain and arthritis, and it's going to aggravate my mood and my psychiatric symptoms. Um, right now, I'm just doing this video as part of my way to cope, get things out of my system, um, and it's also part of my daily schedule. I'm about to do some work on my computer. I do consumer surveys for extra money. I have to pay my bills in a couple of days. I get my money on the 3rd, my disability payments, and I have to pay my rent, my internet bill, my cell phone bill, electricity and heat's included in my rent, um, but not air conditioning. Don't need air conditioning right now. It's late or early November. Um, but not much else to report on. My peer support specialist just called me a few minutes ago because I missed her last appointment with her, and we rescheduled to November 10th at 2 p.m. in the afternoon. I'm seeing my therapist on November 7th in the afternoon, I believe. Um, and I'm seeing my psychiatrist in about 5 or 6 weeks. I was seeing my psychiatrist once every 4 weeks, but we agreed to do it once every 6 weeks. It means I have to take less trips out to my clinic by bus, which gets more difficult to do when it's winter because my mental health clinic is outside of Rochester, and I have to take a pretty long bus ride to get out there. And the fewer trips that I have to make, the better. Um, but beyond that, there's not much else to report. I'm in control of my behavior. I'm not suicidal and I'm not violent. I just feel really agitated and uncomfortable right now.